Please help. Extreme swelling, muscle pain, restricted movement 11 days after a chin implant. Should I be concerned? I had a silicone chin implant placed with under chin incision 11 days ago. In the last 24 to 48 hours, I'm very concerned. My swelling has drastically increased. The muscles under my chin and even down my neck are very sore. I struggle to smile, chew, open my mouth, and even swallowing hurts the under chin muscles. My plastic surgeon says to take acetaminophen and apply warm compress. Can someone please tell me if I should be concerned? Note that I had no signs of a double chin before, just a receded chin.
Thank you for your question. You submitted your question with 2 photos, and you stated in your question that you had a chin augmentation done about 11 days prior that was uncomplicated, and that you state that in the last 48 hours you developed significant swelling as well as struggling with smiling and chewing and movement, and you state that your plastic surgeon told you to just take acetaminophen and warm compresses. So you're looking for some guidance as to what to do given this change. Well, I can certainly share with you my perspective, of course limited without a physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people improve the appearance of the chin is a part of my daily practice, whether it's with the use of chin implants like you had, or with injectable fillers through a method called structural volumizing, again using injectable filler. So I would say that when you talk about chin implants to any specialist who performs this type of surgery, generally speaking, it is a fairly straightforward procedure where after a small incision is made under the chin or from inside of the mouth, a silicone type of implant is generally placed under the periosteum, which is a layer that's overlying your bone. And as I said, generally speaking, once it's placed, it can be fixated and usually stays in place without any problem. And most people feel pretty good even a week out. Yes, they can have some degree of some mild swelling, a little bit of irregularities when it comes to facial movement. However, chin implants are not without complications and problems. And even the most well-known, well-respected surgeons with tremendous experience will periodically have problems with chin implants. Sometimes just things don't go the way you expect them to. And you can have a problem such as bleeding or infection. And so I think that what basically raises a red flag for me is that in the short course of 48 hours, which is about after 9 days from your surgery, you had a sudden change and a sudden worsening of symptoms to the point where you are struggling to move your mouth. Now, that does not sound right, and you describe in your question further that you didn't have a double chin before the procedure, which speaks to me of a significant amount of swelling. Now, your doctor advising you about the acetaminophen and the warm compress, what you didn't clarify in your question was whether or not your doctor had examined you. I think that what is very important is for your doctor who performed the surgery to examine you and to evaluate and feel. This is the doctor who knows your face and knows your anatomy. And if you are dealing with either some bleeding or the onset of an infection, then there is only one option, which is to remove the chin implant. So I think it's very important that you see your doctor in person. If your doctor isn't available, see another doctor. These kinds of symptoms are very concerning and should not be just minimized as something that's normal. Because again, as for an uncomplicated process of chin augmentation, it is routine for our patients to feel really good, and a week later we take their stitches out and they really love their appearance, and then 2 weeks later they look even better. So this sudden change is concerning, and I agree that you should, or I should say that I really would encourage you to see your doctor and see them in person to examine you, because there is no clear basis that could be justified for a normal course of healing that would involve a sudden worsening of some symptoms as specific as yours. So I hope that was helpful. I wish you the best of luck. Thank you for your question.